Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hello, everyone, and we're glad you can attend Attitude's weekly ADHD Experts webinar. We do hope that everyone is staying safe and staying well. Just some housekeeping before we get started. If you've listened to one of our webinars before, you know we offer attendees a certificate of attendance. When the webinar ends, a post-event survey will pop up. It will list 3 questions about the quality of the webinar, followed by 3 questions titled Required for Certificate. If you would like a certificate of attendance emailed to you, you should answer those 3 questions. If you don't want a certificate, well then, don't answer them. Today's webinar sponsor is Play Attention, Enhance Brain Health and Performance. For over 25 years, Play Attention has been helping children and adults thrive and succeed. Their NASA-inspired technology and cognitive exercises improve executive function and self-regulation. Each program includes a lifetime membership and a personal executive function coach to customize your plan along the way. Call 800-788-6786 or click on the hyperlink on the screen for their free ebooks on executive function and academic success, impulse control, mindfulness, and more. Or you can go to their website, www.playattention.com. Mention Attitude Mag 0420 and receive 10% off your home or professional program, plus 1 free ADHD assessment. Attitude thanks our sponsors for supporting our webinars, but we'd also like to let you know that sponsorship has no influence on speaker selection or webinar content. Now for today's topic, deciding to medicate a child with ADHD. It is one of the toughest questions parents have to answer. Families literally agonize over it. There are downsides and upsides to medication. The downside is possible side effects, appetite suppression, and worries about how pharmaceuticals affect a young brain and body. The upside is better symptom control in many cases. There's a whole range of emotional issues involved in going down the medication path. Feeling guilty because friends and relatives question why you may have decided to give a small child a pharmaceutical. Tough discipline should take care of misbehaviors, they often say. You don't need a drug to do that. On the other hand, another set of friends or someone at the playground is surprised that you haven't medicated your child after a meltdown or some grand misbehavior in public. They gently or not so gently suggest that you might consider medication as a solution. Then there is the thought that perhaps your child would be doing better in school if medication was brought on board. The last thing you want to do is have your child fail courses in school. The questions are so tough to answer. Dr. Roberto Olivardia, is here to give us fresh perspective on this difficult issue. He is a clinical psychologist and lecturer in psychology in the Department of Psychiatry at Harvard Medical School. He maintains a private psychotherapy practice in Lexington, Massachusetts, where he specializes in the treatment of ADHD, obsessive-compulsive disorder, body dysmorphic disorder, and eating disorders. Dr. Olivardia is a member of the Attitude ADHD Medical Review Panel and a paid consultant for Understood.org. You can ask questions of Dr. Olivardia during his presentation, and we will try to get to as many of them as we can after he finishes. If you want to download the slides of this webinar, click the drop-down menu labeled Event Resources on the bottom left of your screen. If you do not see the Event Resources tab, you need to refresh the page. So with all that being said, thanks for being here today, Roberto, and we look forward to your insights.
Great, thank you, and hope everybody out there is staying safe and healthy. And actually, this topic is certainly goes to the theme of health in general in terms of treatment. for ADHD, and as Wayne had mentioned in the introduction, a decision that is heavily weighed with many parents in terms of whether to have medication be part of their children's treatment or not. So I'm going to talk just a little bit about kind of the benefits and side effects, but really go more into the decision-making process and the concerns that I hear from parents on either end, the concern of medicating a child or not. So first is we have different medications, stimulant medication, non-stimulant medications that are effective in treating individuals with ADHD. And what they basically do is affect different neurotransmitters in the brain, namely dopamine and norepinephrine. And the ADHD brain, particularly with the neurochemical of dopamine, finds that there is sort of less available dopamine in the brain that is implicated in things like motivation and reward-seeking behavior, impulsivity. And what the medication does is create sort of a more fluid transportation of these neurotransmitters that then result in a lot of positive benefits. And those benefits, and these are things that patients who take medications will tell you, that they feel an improved level of focus and concentration. They find themselves, and by that, I have a patient who prior to medication could really only sit still and read for 15-minute windows. Post-medication could sit and read for an hour, which is a very big difference in terms of productivity. Better regulation in various domains, and what I mean by that is the ability to regulate one's behavior. It could be regulate their eating habits. It could be regulating their attention, certainly. Their sort of any verbal impulsivity. Regulation is such a core piece of what ADHD is. Improved executive function, the ability to manage time better, to organize, to make decisions, and again, I guess this goes also with regulation, with emotional regulation, that people find that medication can be very helpful in that. Improve motivation to do certain tasks and to actually execute them. Less impulsivity. So it's not that a person might not have that thought to be impulsive, but oftentimes they'll report that they feel like they have a pause button, that their ability to stop themselves before they might engage in something that's inappropriate or uninhibited, they're better able to sort of be mindful to that process. Improved academic functioning, which is often one of the main reasons that parents might make that decision to have their child take medication. And one of the benefits of stimulant medication, particularly not non-stimulants, but for stimulant medication, is they're very fast acting. I mean, the day you take them, the impact that it has. So compared to any other class of medications, antidepressants, antipsychotics, mood stabilizers, that you have to be on it sometimes 2, 3, 4 weeks before you really see its effectiveness. It has to build up in your body, your bloodstream. Stimulants, the day you take them, people can report what it does for them. So as far as a trial basis, this class of medication is ripe, actually, for people to go on trials to try and see without a lot of investment of time. So in terms of side effects, there are also side effects to medications, and some people will experience none of these side effects, and some people will experience all of them. And that's the other thing, is that no two people are exactly alike. And I have seen this even in identical twins. I worked with twins over the years, but I remember in particularly these identical twin brothers, and I worked with them at separate times, and they both had ADHD, but they both responded to different medications, and they have exactly the same DNA. So it shows that even in people who have duplicate DNA, that there are all these other variables that are at play that might make one medication more tolerable to someone, or more effective or less effective. So those side effects, reduced appetite is probably the most common one, particularly in young people. Sleeplessness or fatigue, irritability or anger, a rebound effect. And what that means is that when the medication starts wearing off, usually towards the end of the day or after school, parents will report that their kids have this either surge of very hyper, almost looks like manic energy, or they get extremely irritable or very angry or very emotional. And that could last, sometimes an hour, can last sometimes a little longer, sometimes shorter. Tics. So tics is not, medication has been found not to necessarily cause tics, but people who tend to be predisposed to them, it might sort of push it over the threshold where now they might have tics that otherwise you might not see with that degree without the medication. And negative mood. So what are the concerns that parents have? And these are all things that I've heard, and I'll sort of respond to all of them. So probably the most common one that I hear from parents is, I love many aspects of my child. I love their zest. I love their spontaneity. I love their personality, their sense of humor. But there are these other parts that are really challenging and really difficult, as well as these other aspects that I know are causing them to suffer in terms of their social impulsivity. They're not being liked very well by friends. But I want all the good parts of their personality to stay intact, and I'm afraid that the medication is going to take that away. So my response to that is, if a medication makes your child a zombie, if it takes away all of those sort of positive aspects, then I would not consider that a successful medication trial. That we don't want to just make have your child focus in school, but then have no personality. Now, at the same time, I also let people know, and I said this to a lot of adults too, that sometimes personality changes could be positive as a result of the medication. So to give you an example, one of the parents I worked with said, well, my child isn't as sort of funny, and but at the same time, part of why they're not, is spontaneously humorous is that they're paying attention, and so they're not the class clown in school anymore, and they're not known as the funny one, but it's not that they've lost their sense of humor. Actually, what the medication did is properly inhibit their, them telling jokes and stuff like that. So they said they found that, I should actually rephrase that, and the parents end up rephrasing. They said, it's not that my child actually is less funny, it's that they're more appropriately funny at the right times. And so, yes, there's a change in personality, but that's not a negative change in personality. But yes, if your child is a zombie, if they're out of it, that I would not consider that a successful trial. We want all the positive aspects and the core of who your child is to be there. And we're not looking to just create, a quote-unquote perfect student. They're too young, and there are a lot of concerns, especially with young children. Now, as far as guidelines go, and I'm not a psychiatrist, I do not prescribe medication, so this is from the research, is typically for stimulant medication, it could be about the age of 4 is typically like the youngest that a lot of people that doctors would typically prescribe. For non-stimulants like Strattera, it's usually the age of 6 is seen as the youngest. And I have worked with kids who are 5, 6 years old who are on medication, and it has been extremely helpful for them. And again, a lot of parents get judgment, as I'll talk about later around this, but to give you an example of why a 4 or 5-year-old might need to be on medication, is I worked with a young child many years ago. He was 5, and his mom and dad were agonizing over this decision, but they said that their son was almost hit by a car 5 or 6 times, almost hit and killed, because he would run out into the street. He would do incredibly dangerously impulsive things that they had not experienced in their 2 older children. They said it's almost crazy making, and they were really questioning, is there something more than ADHD here? And there wasn't. He was just incredibly impulsive, and they feared that he was going to be hit by a car and killed. They feared that he would electrocute himself because he would stick things in electric sockets. So when they made that decision to medicate, I said to them, look, this is really about what are the symptoms, what are we trying, to help him here with, and he's over the age of 4, so it's not that it's contraindicated. And when he was on medication, all the good things about him and all the positive things of his behaviors were there, and he wasn't doing these dangerously impulsive things. And they did not regret it 1 week after he started taking it, because they said, oh my gosh, we're not nervous leaving him alone in a room. They would literally fear just going to cook a meal and leaving him in the living room because of very dangerous things he could do. So stimulant medication, 4 is seen as the youngest, non-stimulant 6. And studies also show, too, that there's no more of a harmful effect. In fact, with medication, keeping in mind that sometimes not medicating a child could actually put them at more risk for certain behaviors. Sometimes, particularly for adolescents, that I'll hear from parents, well, they were fine, even though we know they had ADHD, they were fine without medication for years. So why would we need to put them on medication now in high school? Well, the answer being that there are lots of people that might not need where it's necessary for them to be on medication because when they're younger, because maybe they have enough internal resources, they have enough support to sort of get through and get done what they have to do without it being very consequential on their self-esteem, on their mood state. The problem, or the difference, I should say, is that as we grow older and as we move to high school, the executive demands exponentially increase. And so what is expected when you're in second grade is very different than what's expected when you're in 10th grade, not only in terms of material, but in terms of independence. What is expected of what you should be, quote unquote, doing on your own, and the amount of support that you're getting from either the school or parents or family. And so I've worked with lots of people who were very bright, again, had a lot of resources and got through elementary and middle school, even though they had ADHD and they knew it was there, and it might have gotten in the way a little bit, but not enough that was very worrisome or consequential. And then they hit high school, and things got real in a very different way. And the stakes were also higher because if their plan was to go to college after, it really mattered to them in a different way. So keeping in mind that there are lots of people, I've also worked with adults who similarly, if they're, might be taking medication now because they're in an environment that really has a very high executive demand with very little support. So it's really, medication is also helping, in a sense, sort of support where somebody's resources either internally or neurologically, as well as more external resources might not do enough for. Sometimes the concerns are around it's too much work to make all these different appointments. I don't want my kid to be a guinea pig. We have to refill it every 30 days. And it's true. Those things, there is definitely a commitment and an investment when you're taking medication, especially stimulants, because they're seen as a scheduled substance. So you're only going to get a 30-day refill, 30 days, often at a time. And sometimes it does take a while to find the right medication, the right dosage, and it can feel that way. And I, tell people if you want to do this, you almost have to be prepared that the first medication may not work, and it might take a couple, and the child has to be aware of that too, and let them know that that's actually more common than not. However, the decision comes to, is that going to be worth it? So is even, let's say, a month of that going to be worth it enough that if and when you do find something that works, it could really then be a lifetime or years or months or, a long period of time where it's actually going to be working for them. The fear of judgment. Parents definitely feel and are, not just feel, they are judged by other people in their lives, other family members or friends for, how can you put your kid on medication? And they fear that, and I'll talk a little bit later about how to respond to that. Parents fear that their kids will use medication as a crutch or that they'll become dependent or addicted to it. I've never actually had someone with ADHD who has taken a stimulant medication who has developed an addiction to it. If they find it useful, then on some level they're dependent on it, but not dependent in an addict mentality way. They're dependent on it in the same way that somebody who has a broken leg might be dependent on crutches or a wheelchair ramp, that they need that in order to do and execute what they need to do, as opposed to just taking the substance and getting some kind of high off of the substance. I've worked with plenty of teens who do not have ADHD who are addicted to amphetamines and Adderall and those drugs that they buy off the streets or from people who might have those medications. But the medication does something very different to an ADHD brain than a non-ADHD brain. The brains are very different. So I've never seen that addiction or dependency. I've seen people who definitely know if it's working and they are not taking it, they're going to see a very big difference. Just in the same way that if we can all say we're addicted or dependent on sleep, but none of us would argue that sleep is incredibly important and healthy because that's what keeps us functioning. And if we did not sleep, we would notice the difference and we would crave sleep. But that doesn't mean we're addicted to it. It's that our brain and our body needs that. And that's what medication is aimed to do, is help an individual sort of buffer the parts of their neurology that isn't working in ways that are going to really be helpful. Parents fear that their children will be resentful about having to take medication and resentful of the parents for, quote unquote, making them take medication. And sometimes that's true. And, as part of the conversation is letting a child know that you would only make this kind of decision in the best interest of the child, and that I would validate to them, yes, it could be a pain to go to the nurse's office and to take this pill every morning. Although I have to say, a lot of the young kids I work with really don't have a lot of the same stigma that they did around ADHD medication as they did 20 years ago. There's been a big change in that with young people. Many of the young people I work with have friends who have ADHD who also take medication. It doesn't have to be a last resort. And sometimes parents think, well, we haven't exhausted everything yet, and it wouldn't be fair. And sometimes parents do. They'll try the behavioral work, they'll try charts, they'll try schedules, and then as a last resort, take medication. That's fine. At the same time, that in the case of the parents where their child was wildly impulsive, they felt like they didn't have enough time almost to work with to really try to have a behavioral protocol. They just were trying to medicate a symptom. And so you don't have to go through all the different treatments if this one is available. And it doesn't make you a bad parent. And it doesn't, again, as I talked about stigma, that many children, not all, but many of them have seem to be more fine with taking medication than before. Now, at the same time, some of them might feel stigmatized. What does this mean? Is my brain broken? Is it bad? Is it wrong? And so we want to let them know that that's not the case at all. In fact, that their brain has these amazing strengths, and part of ADHD is sometimes it kind of clouds those strengths, and the medication is meant to sort of move those clouds away and enable a person to sort of get from point A to point B. No different than a child that might need glasses, someone who might be hard of hearing, having a hearing aid, someone, if you have a broken leg, you need, crutches, and then eventually the leg heals. And part of it, too, is letting the child know that the medication is part of it. Anyone, even if they're taking medication, is still going to be hopefully learning skills and strategies that are also giving them a sense of self-efficacy. Having your child take medication is not an indicator that you're a poor parent or that you're failing your child. In fact, it's the opposite. You're doing what you think is best for your child. And so if your intentions, which all of the parents I've worked with, their intentions are to help their child and to give their child the best chance for success where all their strengths can be realized, that's what a good parent does. A good parent is motivated by good intentions of helping their children, and that's what this is about. So it's unfortunately in the medical community, mental health community, many years ago, it was looked at as ADHD as poor parenting, and I'm sure it still is in certain pockets. That's not true. Sometimes parents are concerned because they're like, well, am I putting my child on medication to make it easier for me? And is that selfish? And what I say to that is, that certainly it can be very challenging to raise a child with ADHD in many different ways, especially if they're hyperactive, if they're impulsive. But I always tell parents, you are your best tool when we're raising children. We have to understand that how we feel. So, I've had parents say, I feel aggressive sometimes when my child just doesn't sit still. I just want to literally glue them to the chair. I just want them to shut up because they don't stop talking, and I feel bad that I feel that way. And I tell them, but you have to use that data and understand that if you feel that way as their parent who loves them unconditionally and would die for them, then imagine how their classmates are going to see them. Imagine how their future coworkers are going to see them. Imagine how their future spouse is going to deal with that. If that's not managed, no one is going to have your child's back the way that you do. And so if you're feeling like that, don't judge yourself for it. And obviously, we don't want you to hit your child, and that's not going to help them. But use that data enough to say, you know what? This will make parenting easier, absolutely. But again, it's also because it's making my child be more successful and helping them manage themselves better. Medication is unnatural, and a lot of parents have concerns about that. And, I guess from that perspective, it brings about this whole conversation about how we just look at medicine in general. If you have a throbbing headache and a migraine, do you take an aspirin for it, or do you just go through your whole day kind of suffering with that headache? Again, if your vision was impaired, do you squint the whole day where you can kind of get by, but it won't be at your best, or do you just put on glasses? And yes, it's something that it's a technological medical advancement, and I have gratitude that that's available for people in the same way that I have gratitude that there are antidepressants and mood stabilizers that save millions of lives because people can lead functional lives. So just because it's quote-unquote unnatural doesn't mean it's harmful. Just in the same way, for those of you who might have tuned in a couple of weeks ago to the cannabis and ADHD talk I gave here on Attitude, people's argument sometimes is that, it's a natural substance, therefore it must be good. Not true. Cannabis is quote-unquote natural, but it doesn't mean it's good for you. Medication could be seen as unnatural, meaning it could be created in a lab, but it doesn't mean it's harmful to you. Sometimes parents have financial challenges around medication, which are valid, that if their insurance doesn't necessarily cover it, that can be a concern. I can do a whole other talk just about ethnic and racial disparities, but I wanted to just put a bullet point around how parents who come from different cultures might look at medication. As someone I have two immigrant parents that, when people come from other countries where medication is not sort of seen as a primary mode of treatment, they could look at medication as something that Americans do. It's this sort of instant, quick fix in some way. Or sometimes they feel this judgment around especially if you're a parent that is really looking to assimilate and kind of be seen in a certain kind of way, it can feel very even more shameful or more judgmental. There's a lot of research that shows that people of color are sometimes told, in some communities are given less access to medication, and other communities are told to be put on medication before other behavioral strategies can work. So there's a lot of discussion that could be put around that, and a lot of mixed messages around how people of color sort of even have that relationship with the medical community and with medication. Sometimes parents feel forced by the school, where school systems would say, your child really needs to be on medication. And sometimes the parents are like, well, do they? Or maybe the school has to do a better job at providing the right resources, so they're hesitant to put them on medication because they want to make sure that that's not an easy pass for the school to do what they have to do. Of course, the side effects, and parents also have to contend with their own biases and judgments that they may have had toward other parents in the past who had their child on medication. When it's in our backyard, we're also like, oh, well, now maybe I don't look at Mrs. Smith next door who who her kids are on medication, and maybe I judged her for that, and now I'm in the same position. Now, just as there are parental concerns of medicating a child, there's also parental concerns of not medicating a child. So parents will say, I'm afraid if I don't medicate my child, are they going to do so poorly in school, and then I'm going to be regretful that I didn't give them the best shot or the best opportunity. They're concerned by not medicating their child that they might fall into addictive behaviors, particularly in families that have a history of addiction. People with ADHD carry a much higher rate and risk of addictive behaviors. So they see that the medication could be very helpful in regulating a child when they're young, so that it makes it easier for them when they're older to not fall into some of those addictive behaviors. Just as there's a fear of judgment of medicating a child, parents feel sometimes a fear of judgment of not medicating a child. It's so hard to be a parent. As you'll see, some of these bullet points are the same for medicating and not medicating. So I was working with a family recently where the mom said, and in this case, the child is not on medication, and the behavioral work that we're doing is actually working very well, and that I didn't think it was a necessity that they be on medication. And the mom said, yeah, I think so too. I think he's doing fine, but part of me, I'm getting judgment from my friends who have children with ADHD, who all of them are on medication, and they think I'm sort of holding back on the medication. And I'm trying to explain to them that my child is actually doing fine, like with the behavioral work that he and I are doing. And so sometimes, parents are going to get judgment either way. They fear their kids are not going to have friends, and because of their behavior, if they are not on medication. Family conflicts, they fear in terms of their eating habits or sleep habits that medication, if they don't put them on medication, that those will become greater problems. As in the case of that patient I mentioned, they might fear accidents or impulsive behaviors. The emotional dysregulation sometimes they see in their ADHD children, that they think, gosh, that, aside from it being challenging for a parent, it's heartbreaking to see your child in just a total, meltdown, and thinking, if I don't medicate them, am I putting them at more risk, where their brain is sort of experiencing all this emotional turmoil. They fear their child will be resentful if they don't medicate. And I've actually seen this in where, I'm working with a college student now who his parents decided not to put him on medication when he was in high school, and he started medication now, and for him was night and day. And he was very resentful of his parents saying, why didn't you do this earlier? And I'm working with him. We just started working together, and helping him and supporting the parents and saying they did really what they thought was best, and that if they knew it was going to be this successful, they absolutely would have done it. And I have no doubt they would have done it. So part of it is, understanding that sometimes it could feel like you're damned if you do, damned if you don't. They might feel like they're failing their child if they don't medicate. And sometimes parents, I work with parents who fear that they may lose control dealing sometimes with their ADHD children. Like they actually fear that they may abuse them, like physically, beat them. I had a parent who's called me in tears and says, I'm telling my child with profanity to shut up. And I don't want to be a parent that tells my child to shut up using a lot of profanity. But I can't. It's like the behavior is so out of control. And so sometimes the decision of medication is, and I told them, I said, again, if I obviously want to support the parent and give them whatever resources they need, but also keeping in mind that this is an indicator that perhaps this is going to be challenging to everybody. So what do you do, and how do you manage others' judgment or criticism? Because lots of times when it comes to medication, and especially with ADHD, I would say more than any other condition that I treat, the issue with medication is the most controversial. I don't hear from parents as much when their child has severe OCD that they're on medication for their OCD. But with ADHD, there's a lot of opinions that people might have. One of the responses I always, recommend for parents that if they do get outright shame, judgment from other people is to say, look, if you've never considered medication, either because your child doesn't have ADHD or maybe they do have ADHD, but if you've never considered medication at all, it's likely that you're not in the same situation that I'm in where you have to consider it and be grateful for that. And maybe for your child, you've never had to consider that because they're, the way their ADHD manifests, whatever resources they have, but I'm not in that position. And it doesn't mean because I'm lacking something in terms of my parenting or my love or support. It's just the assumption of equivalence is a fallacy, that you could put 100 ADHD people in a room and they're all going to manifest different aspects of ADHD differently. So not all brains are created identically. And so to assume that is it's laughable. The idea that just because one person's child is not, and even within families, I've come across this where if parents have 3 children who all have ADHD, not all of them are on medication, and sometimes not all of them are not on medication, meaning that they might make the decision where one of the children really need the medication, but the others didn't. And that could be hard, too, because they're like, well, my other 2 kids aren't on medication, so is there something wrong that I'm having this one? I'm like, but you're assuming that all 3 of them have exactly the same brains and same experiences and same executive functioning, and that's not the case at all. There are people that still believe that ADHD is not real, that it's fictitious, and unfortunately there's still a lot of ignorance around it. Oh, aren't we all ADD? I lost my pocketbook yesterday. I guess I'm ADD. And if this is someone that you think is really open to being educated about it, then I would, if you feel it's not your job to do this, but if you want to say, actually, I could see how some people think that, but this is a real neurologically based condition. It affects a large percentage of people compared to some of the other conditions that we see. But it's tough because you don't always see it in the same way, but the behaviors people can see. But unless they're inattentive, the inattentive types, we're not always going to see the behaviors. Or people might say things like, they just need more discipline. If they were disciplined better, they wouldn't be getting out of their seats. They wouldn't be, doing those things. That's not true. But what is true is that if a child is fearful, yeah, maybe they're going to stay in their seat and not be bouncing off the walls and hyperactive, but that doesn't mean that they're still, not daydreaming or being inattentive, or that that's good for them. A great example of that is years ago working with a 12-year-old boy and his father, who also has, I should say the father was very frustrated with his son, and I had asked the father if he has ADHD, because I knew the mother did not, and he's like, no, I don't know, but maybe, but, I was a really good student, and he went on to talk about his family life, and basically he said when he was very young, and he got his first write-up when he was not paying attention and being rambunctious in the classroom, a teacher wrote a note, and his father beat him that night. And he said, I learned not to be rambunctious and the class clown since then, but I lived in fear of my father beating me. And so that's not how we want to deal with it. And I said, well, that's very sad, because in some ways it's almost like the ADHD, the symptoms at least were sort of beat out of him, but internally he said he still had trouble paying attention and not focusing, but just was so fearful. And so, giving a child discipline, yes, maybe they're going to sit still, but it doesn't mean that suddenly they're going to be able to focus better. It doesn't mean they're suddenly going to be able to write that essay with perfect executive functioning. Also, because we know it's a neurological condition, to say, would you deny insulin to a diabetic? Would you deny glasses to someone who's vision impaired? That this is neurological. There's a wealth of research that empirically shows that ADHD is a neurologically based condition. And so we have to frame it in that way. And, the simplest thing is, look, I know my child best. And so your opinions are your opinions, but honestly, my opinion is more well-informed. That's what it comes down to. Also, sometimes I'll work with parents who their parents, so the patient's grandparents, will be the judgmental ones saying, well, you kind of had these symptoms and these behaviors, but we never medicated you. And, I would respond by saying, well, first of all, there was a different time, different place, different executive demands, and you could say in a very respectful way to as an adult to your parents, I know you did the best you could, but I may have benefited from medication. I may have, and I'm not judging you for making that decision because I'm trusting you did what you thought was best. But also keep in mind, my kid or their grandchild is growing up in a different time with different demands. I know for myself, I'm so glad I didn't grow up with the internet. Like, my whole high school experience would have been different. And I fully appreciate what it takes for a child, and my son who's ADHD and dyslexic, to grow up with those kind of distractions it's a game changer. It's like a totally different experience. So to compare my experience with ADHD with his is not fair to him because he's growing up in a very different time. What he's doing in 9th grade is the kind of curriculum I was doing in 11th and 12th grade. So the demands have also risen. If you don't want to medicate your child, you can say, look, I'm not passing judgment on any parent's decision, but I know what's best for my child, and we're working on other ways. And that's important, to not pass if you decide not to medicate your child, which is that's fine, but not to pass judgment on other parents who are, and to let them know, that you're not holier than thou and looking down on those parents, but you are looking at what's best for your kid. And I also say when it goes to the, medication's unnatural comment, a response to that is, look, medication is a lot more natural than suffering unnecessarily. Suffering in a constant state for a young child is not natural. You want your child to be happy, have friends, feel a sense of self-worth. It's unnatural to have a child say that they should be dead because they're worthless, which is what some children can get to when they feel so dumb or worthless or ineffective or unlikable. That's unnatural. We want to eliminate the shame. We want to let people know what works for one child may not work for the other. And also understand the role of privilege when it comes to this decision that, it's easy for a family, let's say, that has resources, financial resources, that could hire a tutor, that can, where maybe it's a single parent family, a single earner family, where one of the parents can be at home and sit right by that child's side to help them through their homework, where they can hire a lawyer to go to IEP meetings to make sure the school is doing the right thing. And it's important that we all understand that there's a role of privilege here to say, well, my kid doesn't need to be on medication. Well, but they're getting all of these supports that some people can't afford and can't do. And so medication, may look like the quote-unquote quick fix, but it's all about what's going to help my child, give them that opportunity, that they need. So in weighing the decision, the first question is, what are we actually medicating? Because sometimes, with parents are like, okay, they have ADHD, should we medicate? My answer always is, or my response is, well, what is it that you need medication for? Is it for their executive function? Is it to reduce impulsivity? Is it emotional regulation? And let's really target what it is so that if you do a trial, we know what we're actually measuring. And if you decide not to medicate, then that will help in the treatment that I do with them. What are we actually focusing on in terms of psychological treatment? And what's that threshold? Sometimes parents are like, yeah, it's kind of tough, but we're working at it. But once it crosses this line, then I think medication will be more on the table. And that's different. The threshold is totally different for different families, for different kids, for different parents. And not to assume that your threshold has to be the same as your neighbor's threshold. Consider comorbid disorders. If your child just has ADHD, that could be a different experience than your child who has ADHD and dyslexia, ADHD and depression. And that may also influence whether medication is useful or something that you see as necessary. Be aware also that there are side effects, which I mentioned earlier, and then there are unintended effects, which are different than side effects. And an example of that is when I work with children who have ADHD and obsessive compulsive disorder, or OCD, sometimes a stimulant medication makes their OCD worse. And sometimes it makes it better, but sometimes it makes it worse. Now, that's not a side effect of the ADHD medication, but what they will report is that their focus is a lot better in school, but their focus is also a lot better on their obsessive, intrusive thoughts, and that's not what we want. So that's an unintended effect, but it's not a side effect. It's the medication is doing what it's supposed to do. It's increasing a level of focus, but if you are a very anxious person, that increasing level of focus could be on the anxiety or the thing you're anxious about. And understand that parents and children have different personalities. Sometimes it's the parent that has ADHD that is more tolerant and has more of a bandwidth in working with their child. Sometimes it's the parent without ADHD that has more of the bandwidth, because sometimes the parents that are too similar, it could be very difficult, and parents with ADHD might have their own emotional regulation issues. So in managing attitudes on medication, it's so important, first to assess what is your trust in the medical community and mental health providers. Do you see them as just pill pushers? Do you see them as being paid off by the pharmaceutical industry? Do you see them as people who truly want to help your child? And so I always assess how parents feel about that before even going, making a recommendation. Know that not everyone responds positively to medication. There are lots of people I've worked with ADHD that don't really get a benefit from it. So the behavioral stuff is the only part of the treatment. Manage your expectations to find the right medication and dosage. It's not going to make your child like something that they don't like. I remember having a parent years ago that said, he's been taking Ritalin and he still doesn't like math. And I said, well, he's going to hate math. If he hates math, he hates math. However, he'll find it's probably easier to get math homework done, especially seeing that he hates it, and that was in fact the case. Pills do not teach skills, so if you decide medication, that is not the only mode. You always have to have that behavioral, executive function, coaching, self-esteem work in there. And I always like to explore with parents their attitudes fully before a kid tries a medication. Talking to your kids, too, about medication is letting them know it's like wearing glasses. They just need something that's just going to help bring out their strengths. They're not alone. And again, most of the child patients that I work with have friends who have ADHD, who are diagnosed. Or look for celebrities that they admire who have ADHD and say, look, here's this athlete, this entrepreneur, this scientist, this rock star that has ADHD. If you decide not to medicate, to say we are trying other strategies, but we're not going to judge other people who take medication because they may be doing what's best for them. We may go down that route at some point. And I think that's important too, because you don't want to say, oh no, we would never do medication. That wouldn't be good, because then high school could come and your child might need really, at least it'd be worth having a medication trial, and you don't want that child to remember you saying, oh yeah, medication is not good. So you want to always keep it as an open avenue. Teach kids that their accomplishments are reflective, if they're on medication, that their accomplishments are reflective of their ability and hard work, as opposed to, oh, the Adderall gave me an A. No, the Adderall put you on a platform that allowed you now to utilize your strengths and put your work into an executive action. And conversely, keeping in mind, especially if people are not on medication, that their failures could be indicative of these ADHD symptoms, and not that they're not smart. And it doesn't mean, again, that they have to take medication, but then to say, look, maybe you got a D because you're struggling with how to study and time management issues. So that's something we should work on behaviorally. And adjusting meds is very common as development and executive demands increase. And treatment, I have lots of treatment with people who don't take medication. And you want to hit a lot of these same things, whether they are or are not taking medication. Self-esteem being probably one of the most important, because if you have a child think that they're stupid, worthless, unlovable, then they're not going to work. Everything else is going to topple on the pyramid. Their self-esteem, getting the right support, health habits, structure and routines, being mindful and teaching them and this will be, I'm still doing this at my age, of knowing myself and observing myself and understanding where my ADHD sort of pops up and how to work with it. And as a parent, you may need to be their frontal lobe. They're going to need extra support from you. And so it's important for you as a parent to get your support, either from other parents, from a therapist, from a trusted family member or friend. And then, of course, therapy and executive functioning coaching strategies can be very helpful. So I know we have about 10 minutes for any questions.
Yes, we have lots of them. That was excellent, by the way. A lot of parents want to know about the long-term effects of medication on their child's brain or nervous system. And I just wanted to know if you know of any long-term studies or any kinds of studies that would suggest any harm to the brain or any part of the brain or the nervous system.
Sure. So it's a very good question. And one of the benefits of stimulants is that they've been around for decades now. So since, I think, the 60s, there's been some good, solid research. So we have cohorts of people who have been taking stimulant medication for many years, who are in their 60s and 70s. One long-term study that specifically looked at the risk for Alzheimer's disease or dementia, did they find that long-term stimulant use created that, and they did not. When they've looked at other kind of consequences, they have not found that long-term stimulant use creates sort of any medical problems later in life. And the argument actually could be made on the opposite, that for some people, not all people necessarily, but for some people, taking the ADHD medication is actually creating sort of neuronal connections, because if somebody is able to now take in and learn the strategies, like there are sometimes I have patients who I very strongly recommend that the parent explore medication, because they can't even absorb the work that I'm trying to do with them. They're trying, but they just can't. Just like if somebody is profoundly depressed, it's very difficult for them to absorb cognitive behavioral therapy if somebody is just so deep into a depression, despite them trying to. And so that is not good for the brain. And so when somebody's on medication, they're able to learn and take in those skills. That's creating growth in their brain, and which is actually going to be a positive thing. So to answer that question, there aren't. Now, they're with young kids, there's always the concern of, and earlier studies would find that they stunted their growth. That's actually not true. It can be an appetite suppressant. And so if you don't get in substantial nutrition and calories, that could impede your growth. But it's not the medication in and of itself that's causing stunted growth. So what you have to do for those children is make sure that they have a pretty substantial breakfast filled with protein, not just like sugary cereals. And maybe at lunchtime they're not hungry, or they just have a little snack. And then when they come home from school, and then a good healthy dinner. And most of the kids I work with, it's not an issue as long as they're getting that nutrition.
Mm-hmm. A lot of parents have asked, is medication a lifelong commitment, or does one sort of outgrow it as one learns other ways to, manage symptoms?
So we used to think somehow, it's kind of funny that it wasn't until the mid-90s that when Ned Hallowell wrote Driven to Distraction, that the idea of adults with ADHD was a thing. I don't know what I think people thought when you turned 18, it just went out the window. And that's not the case. that most people with ADHD will have ADHD as adults. The difference is that we're not all in this controlled environment called school anymore, and some people are in college, some people are in careers, and we have a lot more options. And a lot of people with ADHD have compensated and navigated through different ways, so it shows up in different ways, but it's not that it goes away. So, maybe the person is successful in college, but their executive functioning could still be impaired in ways. So it's not that the ADHD goes away. You're born with it. We're born with it. And, for me, I see I'm born with it. I'm going to die with it. The difference is, though, that I'm at a point in my life where I feel like, I know I can wrap my head around 90% of it. But again, what you always want to encourage in children is for them to be mindful and curious about it in a non-judgmental way. Like, isn't this interesting that when I sit down here near a window, I'm looking out the window for a half hour and I totally forgot what I read, versus if I sit here away from the window, I can read a lot more. And you don't want them to fall into, gosh, why can't I just read without looking out the window like my friend can? It's like, that's just not how your brain works. But what's important is that that difference, and one of the, again, unintended effects that I see about my own experience with ADHD is I know myself really well, and in terms of what's going to work and what's not going to, and a large part of that is when you live a life of ADHD, you're forced to think that. You're forced to navigate what's going to work, what's not going to work, because you come across so many obstacles. And so as an adult, I feel that things are sort of more second nature in that way. But yes, it will show itself in different aspects of life in different ways, but it doesn't mean it always has to be as challenging as it is when we're younger.
Oh, I like that approach that you have about, making the child curious about it. Isn't that interesting? Yeah, that's great advice. I haven't heard that before, but I think that's very positive. A lot of parents are giving their kids medication Monday through Friday for school, and then not on the weekends. And loads of people saying, are we supposed to give it 7 days a week? So
no. So for stimulant
so
for stimulant medication, no, you don't have to give it daily. I mean, that's, again, the benefit is you can take it that day and the next day not, and it washes out of the system pretty quickly. You're not going to see the sort of withdrawal effects and things like that you might see with other medications. With non-stimulants, it's a little bit of a different story. Non-stimulants, it could take some weeks to build up in the system before you see any results. They generally, and again, I always tell people, check with your prescriber, but generally speaking, it's not something you go on and off of in the same way that you would with the stimulant. So it depends, again, with that question, what are you medicating? So if you're medicating their ability to focus in school, then taking them off the medication on the weekends, school vacations, summers, totally appropriate. I see it all the time, and it's fine. If you're medicating impulsivity, that the school is one domain in which that's a problem, but home could be another domain, then the parents will decide that there is no kind of holiday from the medication, because in fact home could be sometimes more dangerous because they're not as structured, or if they're playing out with their friends, you don't want them getting into trouble. So it really depends on what you're medicating. But with stimulant medication, I work with many college students who they love their classes, they're very engaged, and so they don't need them for everyday classes, but when they're writing papers, they absolutely find that their medication is helpful.
Mm-hmm. I'm going to try to sneak in one last question because it's been asked several times. Several parents have had their child take medication early on, 5, 6, 7. They've had a really bad experience with it. I don't know, maybe the clinician didn't titrate it properly, or it was the wrong medication. And now that the kids have gotten older, let's say middle school or high school, and they're running into some major problems, without medication. So a lot of parents are wondering how should they go about revisiting that option. Because I've heard this before. A lot of parents, a lot of kids have had bad experiences with medication. They'll return to it for quite a while because of the bad experience. So
absolutely.
Just any advice on how to guide these folks?
Yes. So first and foremost, it's so essential to make sure that you're working with someone who has experience working with ADHD. Now, most psychiatric prescriptions are actually prescribed by primary care physicians over psychiatrists, and I'm not saying that's a bad thing all the time. However, that even with your primary care, to ask them like how much experience do they have with ADHD individuals? Are they how much do they sort of work with trying different medications? I find generally speaking, that psychiatrists are more experienced in doing that because that's their specialty. It's almost like if I have a condition, I want to go to the person where this is their bread and butter, like this is what they really specialize in. That's number one. Number two is, even if a child had a bad experience at 5, 6, that doesn't mean they're going to have a bad experience at 12, 13, because developmentally, there's so many variables that can cloud the picture as to where that child is, the dosing, the kind of medication, what else might have been happening, for them psychologically. So if it's something that people want to revisit, to A, not assume the same thing is going to happen, but B, if your child does take medication, take very good notes around what you observe, because it's so easy, especially years later, if you're meeting with a new doctor, to say, oh, what was the experience with Ritalin? You're like, oh, I think Ritalin was the one who was angry, or was that Vyvanse? And so take as many notes that sort of help, but definitely working with someone experienced and understanding that at a different time, they could have a very different reaction. And sometimes it's also where the child feels, how they feel about the medication. I mean, I've worked with teens who, when they were kids, they really resisted it, and they said, I don't even think I wanted it to work because I hated the idea of it, but now I can see how beneficial it could be for me. So there's a lot that should be explored, and I would say, not only with a psychiatrist, but again, with a therapist could be very helpful as well, to just explore even their approach to how they're thinking about the medication and what they're measuring. Again, because a lot of times are we measuring the right outcome and seeing, what the actual benefits are.
Well, that was great, Roberto. I think the hour is up, and I learned a lot, I know that. And thanks so much for being here and sharing your expertise.
Sure,
really
always a
appreciate
pleasure.
It. And thanks to all of the attendees for listening in. We'll see you next week on April 20th when Ned Hallowell will talk about the anxiety, worry, and overwhelm many adults with ADHD are experiencing during the COVID crisis. So thanks, everybody, and have a great day.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com.